This anticonvulsant drug, known by its generic name lamotrigine, has garnered significant attention for its wide-ranging applications and potential benefits. In this comprehensive video, we will embark on an exploration of Lamictal's common uses, advantages, potential side effects, dosage guidelines, and associated risks. Lamictal is a medication primarily prescribed for the treatment of epilepsy and bipolar disorder. Its unique mechanism of action targets specific receptors in the brain, making it a valuable tool in managing these conditions. However, the applications of this drug extend beyond its primary indications, as we will discover throughout this video. By providing a holistic understanding of Lamictal, I aim to empower readers with the knowledge necessary to make informed decisions about their healthcare. Whether you are a patient, a caregiver, or simply someone seeking to expand your understanding of this medication, this video will serve as a comprehensive guide to navigating the complexities of Lamictal. Common applications of Lamictal. Epilepsy treatment. Lamictal is widely prescribed for the management of various types of epilepsy, including partial seizures, tonic-clonic seizures, and seizures associated with Lennox-Gastaut syndrome. Its anticonvulsant properties help to stabilize electrical activity in the brain, reducing the frequency and severity of seizures. Bipolar disorder management. In addition to its role in epilepsy treatment, Lamictal has gained recognition for its efficacy in managing bipolar disorder. It is often used as a mood stabilizer, helping to regulate the extreme highs, manic episodes, and lows, depressive episodes, associated with this condition. Off-label uses. While not its primary indications, Lamictal has also been explored for off-label uses in conditions such as neuropathic pain, migraine prophylaxis, and certain psychiatric disorders. However, it is crucial to consult with a healthcare professional before considering Lamictal for these purposes, as its effectiveness and safety may vary. Benefits of using Lamictal. Seizure control. One of the primary benefits of Lamictal is its ability to effectively control seizures in individuals with epilepsy. By modulating the activity of certain receptors in the brain, it can help reduce the frequency and severity of seizure episodes, improving the overall quality of life for patients. Mood stabilization. For individuals with bipolar disorder, Lamictal can play a crucial role in stabilizing mood fluctuations. By regulating the levels of certain neurotransmitters, it can help mitigate the extreme emotional highs and lows associated with this condition, promoting a more balanced emotional state. Fewer cognitive side effects. Compared to some other anticonvulsant medications, Lamictal is often associated with fewer cognitive side effects, such as impaired concentration or memory problems. This can be particularly beneficial for individuals who need to maintain optimal cognitive function in their daily lives. Potential neuroprotective properties. Emerging research suggests that Lamictal may possess neuroprotective properties, meaning it could potentially help protect brain cells from damage or degeneration. This area of study holds promise for future applications in conditions involving neurological impairment. Potential side effects of Lamictal. While Lamictal offers numerous benefits, it is essential to be aware of its potential side effects. Like any medication, it can cause adverse reactions in some individuals. Common side effects associated with Lamictal include dizziness, headaches, nausea and vomiting, drowsiness or fatigue, blurred vision, rash or skin irritation. In rare cases, Lamictal has been linked to more severe side effects, such as Stevens-Johnson syndrome, a potentially life-threatening skin condition, suicidal thoughts or behaviors, aseptic meningitis, inflammation of the protective membranes covering the brain and spinal cord. It is crucial to report any concerning side effects to your healthcare provider promptly for proper evaluation and management. Dosage guidelines for Lamictal. The dosage of Lamictal is highly individualized and depends on various factors, including the condition being treated, age, weight, and potential drug interactions. Here are some general guidelines. Epilepsy treatment. Initial dose. Typically starts at 25 mg once daily for 2 weeks. Maintenance dose. Gradually increased over several weeks, up to a maximum of 500 mg per day. Bipolar disorder management. Initial dose. Typically starts at 25 mg once daily for 2 weeks. Maintenance dose. gradually increased over several weeks, up to a maximum of 200 mg per day. It is essential to follow your healthcare provider's instructions carefully and never adjust the dosage without proper guidance. Sudden discontinuation or abrupt changes in dosage can increase the risk of seizures or other adverse effects. Risks associated with using Lamictal. While Lamictal is generally well tolerated, there are certain risks and precautions associated with its use. Rash or skin reactions. One of the most significant risks associated with Lamictal is the development of a potentially life-threatening rash or skin reaction known as Stevens-Johnson syndrome, SJS, or toxic epidermal necrolysis, TEN. This risk is highest during the initial stages of treatment or when the dosage is increased too rapidly. Suicidal thoughts or behaviors. In some cases, Lamictal has been linked to an increased risk of suicidal thoughts or behaviors, particularly in individuals with bipolar disorder or epilepsy. Close monitoring and open communication with healthcare providers are essential. Drug interactions. Lamictal can interact with certain medications, potentially altering their effectiveness or increasing the risk of side effects. It is crucial to inform your healthcare provider about all medications, supplements, and herbal products you are taking to avoid potential interactions. Pregnancy and breastfeeding. The use of Lamictal during pregnancy or breastfeeding should be carefully evaluated, as it may pose risks to the developing fetus or nursing infant. Consultation with a healthcare provider is necessary to weigh the potential benefits and risks. How Lamictal works in the body. To better understand the mechanisms behind Lamictal's effects, let's delve into its mode of action within the body. Sodium channel blockade. Lamictal inhibits the activity of sodium channels, which are responsible for the propagation of electrical signals in nerve cells. By blocking these channels, Lamictal can help prevent the excessive firing of neurons, thereby reducing the likelihood of seizures and stabilizing neuronal activity. Modulation of neurotransmitters. Lamictal is believed to modulate the levels and activity of various neurotransmitters, including glutamate and gamma-aminobutyric acid, GABA. These neurotransmitters play crucial roles in regulating neuronal excitability and mood regulation, which may contribute to Lamictal's efficacy in treating both epilepsy and bipolar disorder. Neuroprotective properties. Emerging research suggests that Lamictal may possess neuroprotective properties, potentially shielding brain cells from damage or degeneration. This characteristic could have implications for the treatment of neurological disorders, although further research is needed to fully understand its mechanisms and applications. Precautions and considerations when using Lamictal. While Lamictal can be an effective treatment option, it is essential to exercise caution and follow specific precautions to ensure safe and optimal use. Gradual dosage adjustment. To minimize the risk of severe skin reactions, it is crucial to follow a slow and gradual dosage adjustment schedule, as recommended by your healthcare provider. Abrupt increases in dosage should be avoided. Monitoring for side effects. Close monitoring for potential side effects, particularly during the initial stages of treatment or dosage adjustments, is essential. Promptly report any concerning symptoms to your healthcare provider. Pregnancy and breastfeeding considerations. If you are pregnant, planning to become pregnant, or breastfeeding, it is crucial to discuss the potential risks and benefits of using Lamictal with your healthcare provider. They can help evaluate the most appropriate course of action based on your individual circumstances. Medication interactions. Inform your healthcare provider about all medications, supplements, and herbal products you are taking to avoid potential interactions with Lamictal. Some medications may increase or decrease the levels of Lamictal in the body, affecting its efficacy and safety. Adherence to treatment plan. Consistently following the prescribed treatment plan and attending regular follow-up appointments with your healthcare provider is essential for monitoring your progress and making any necessary adjustments to your treatment regimen. Alternatives to Lamictal. While Lamictal has proven effective for many individuals, it may not be the most suitable option for everyone. In such cases, alternative treatments may be considered, depending on the specific condition and individual circumstances. Some potential alternatives to Lamictal include other anticonvulsant medications. For the treatment of epilepsy, alternative anticonvulsant medications such as valproic acid, levetiracetam, or topiramate may be prescribed. Each medication has its own unique mechanism of action, potential side effects, and considerations.
Mood stabilizers.
In the case of bipolar disorder, other mood stabilizers like lithium or certain atypical antipsychotics may be considered as alternatives or adjunctive treatments to Lamictal.
Psychotherapy.
For the management of bipolar disorder, psychotherapy approaches such as cognitive behavioral therapy, CBT, or interpersonal therapy can be valuable adjuncts to medication, helping individuals develop coping strategies and improve overall functioning.
Lifestyle modifications.
In some cases, lifestyle modifications such as stress management techniques, regular exercise, and a balanced diet may be recommended in conjunction with or as an alternative to medication, depending on the severity and nature of the condition. It is important to note that the choice of alternative treatments should be made in consultation with a qualified healthcare provider, who can evaluate your individual needs and provide personalized guidance.
Conclusion and final thoughts.
In this comprehensive exploration of Lamictal, we have delved into its common applications, potential benefits, side effects, dosage guidelines, and associated risks. While this medication has proven to be a valuable tool in the management of conditions like epilepsy and bipolar disorder, it is crucial to approach its use with caution and under the guidance of a qualified healthcare professional. As we navigate the complexities of pharmaceutical treatments, it is essential to strike a balance between the potential benefits and risks. Lamictal, like any medication, is not a one-size-fits-all solution, and its suitability should be carefully evaluated on an individual basis. Ultimately, the decision to use Lamictal or explore alternative treatments should be made in collaboration with your healthcare provider, taking into account your unique circumstances, medical history, and personal preferences. Open communication, adherence to prescribed treatment plans, and regular monitoring are key to ensuring the safe and effective use of this medication. Remember, knowledge is power, and by arming ourselves with a comprehensive understanding of Lamictal and its implications, we can make informed choices that prioritize our overall well-being.